Welcome back to my channel. In this video, we will be discussing about dental needles, an essential part of local anesthesia in dentistry. Let us begin by looking at the anatomy of dental needle. Dental needle is having a shaft, bevel, hub, syringe adapter, and cartridge penetration end. So let us see what is a shaft first. Shaft is the metal portion of the needle. This is the metal portion of the needle. Bevel is a sharp angled tip of the needle. So this is a sharp and it is an angled tip of the needle. Hub is where the needle is attaching to the syringe. Syringe adapter can either be a metal or plastic. So this portion can be a metal or it can be a plastic. Cartridge penetrating end is a part of the needle that is entering into the anesthetic cartridge. So this portion enters into the anesthetic cartridge. Now let us understand about each component of the needle in detail. Let us begin with the bevel first. Bevel is the tip of the needle and it is designed in such a way that the needle has to penetrate soft tissues with minimal resistance. There are different types of bevels: short bevel, medium bevel, long bevel, multi-bevel, and scalpel bevel. So this bevel is providing the cutting surface. And it is allowing the needle to smoothly pass through the mucosa. So this is increasing the patient's comfort. So sharper is the bevel, easier is the insertion of the needle into the mucosa, thereby reducing the tissue trauma. For example, if you take a multi-bevel needle, it is offering least trauma and greatest comfort. So if you take a scalpel bevel, this is mainly used for infiltrations and also for the PDL injections, that is periodontal ligament injections. It causes less displacement of the tissue, and this kind of bevel needle is not recommended for the nerve blocks. It is not recommended for nerve blocks because of the risk of direct nerve contact. One important thing to note is the angle of the bevel. The greater is the angle between the bevel and the long axis of the needle. This is the long axis of the needle and this is the angle of the bevel. If the angle between the long axis of the needle and the bevel is greater, then there is more deflection. If the angle is greater, then there is more deflection. Or bending happens when you insert the needle into the soft tissue. So if your goal is to give a nerve block, you will need a needle with a minimal deflection. Next, let us understand about the shaft of the needle. Shaft is a long metal tube of the needle. Two things are important here. One is the gauge of the needle. Second is the length of the needle. Gauge is referring to the internal diameter of the needle. What is the gauge? It is the internal diameter of the needle. It is the internal diameter of the needle. A lower is the gauge number. That means thicker is the needle. So if the gauge is 25 and 30, 25 gauge needle is thick when compared to that of the 30 gauge. Next important factor here is the length. So the length of the needle is measured from the bevel to the needle hub. This is the length of the needle. So you may have short needles and long needles. Short needles are used for superficial injections and long needles are indicated for deeper injections like nerve blocks. So when you want to give a nerve block, the needle should have minimal deflection. Hub is a piece that connects the needle to the syringe. So this hub can be made up of plastic or metal. In some cases, you might find pre-threaded hubs, especially with the metal ones, that allow for secure attachment. One practical feature here is that some manufacturers include bevel indicators on the hub. So on the hub, some manufacturers are including the bevel indicators. So this helps you to exactly know where the bevel is pointing during the injection, ensuring that the bevel is facing the right direction and minimizes the tissue resistance, making the injection smoother. Syringe adapter. Syringe adapter is what links the needle to the syringe. It can be made from plastic or metal. This connection should be secure to ensure the needle stays in place during the injections. Cartridge penetrating end. This is the end of the needle that enters into the anesthetic cartridge. So this is the anesthetic cartridge. So cartridge penetration end enters into the anesthetic cartridge. So this end is not sharp like bevel, but this is designed to puncture the cartridge. So this end will be able to puncture the cartridge. So this cartridge penetrating end is allowing the anesthesia to flow into the needle during the injection.
If you found this video helpful, hit the bell icon below and subscribe to my channel, and stay tuned to Tooth Fairy Tales for more dental videos.